You're his assistant. Make sure y'all always see the PowerPoint.
Okay.
I think. I don't know.
Always.
You didn't trust him with that?
I trust me with that.
He trusts himself, so since he trusts himself with it, I don't know. And
Oh, Mike, Freddie, and Art. How did it go? 5, 3, 2.
all right, Angel, if you could just dim the lights, not too much so we don't fall asleep. All right, chapter 11 is about something. Maternal adaptation. All right, they're what? You said they're done?
No, she asked if the lights were turned
Oh,
on.
okay, I thought you said something else. I'm like, All right, maternal adaptation. How does the female, or the one who is pregnant, adapt to that pregnancy? That's basically what chapter 11 is about. And you're doing med surg, you're gonna see a lot of similarities, but there's a little bit of variation as it relates specifically to this client. Well, you're doing basic health. That's med surg for y'all, right?
Mm-hmm.
Yeah.
Okay, should be a little bit. All right. So, you already know pregnancy is divided. You should know that it's divided into 3 stages. We talked about it. Those 3 stages last about how many weeks each stage? 13. Or in other words, instead of stages, what is the common name? Those 13 trimesters. Okay. Y'all looking at me like,
Like what?
All right, so each of those stages, we as nurses, specifically labor and delivery nurses or prenatal nurses, OB nurses, whatever you want to call, we're monitoring the changes to the body, the changes that occur mentally as well, hormonal changes. We are assessing and addressing all those different stages. And we're preparing the body basically for what?
Childbirth.
Say it louder.
Childbirth.
Childbirth. That's the whole goal, is to get another human being added to this world safely. Okay? That's all this is about. See? OB nurses, they got it big, I guess. Now on page 302. This was talked about in no, it was not talked about in previous chapters. You need to know the signs and symptoms of pregnancy. You see that little box right there? Daryl, 1111 on page 302 on the box.
Yes.
What are you not supposed to do with that box?
Ignore it.
Okay, that's that too. Don't play with me. Okay? You see, make sure you know it up until you pass NCLEX on your very first attempt. After which, what you do with that information is up to you. You hear me? Let's go over them one by one, because it will show up multiple times in the remainder of this semester. Okay? And I don't want to hear nothing about nothing. The signs and symptoms that dictate and state that yes, this person is indeed pregnant. You have the presumptive signs. Presumptive, if you, first of all, I don't got my glasses. Jessica.
Hi.
What is, okay, there's 2 types of assessments. 2 main types, subjective versus objective. What is subjective?
That's what the patient says.
Good. Rondi, what is objective?
What is a known fact? Or what you can see?
Huh?
What's measurable, what you can see?
What you see as a healthcare provider. Subjective, what the patient tells you. Objective, what you see or what you can observe as the healthcare provider. Why am I stressing this information that you learned from last semester? Because if you notice, presumptive signs, what do you see as signs of presumptive, I should keep my glasses on. Natasha?
What do we see as presumptive?
Yes. What are the presumptive signs of pregnancy? It's very important.
Tenderness in your breast,
What else?
nausea and vomiting.
good. What else? You know the answer right there in front of you. You don't have to look in the sky. You don't have to look nowhere else. You don't have to look nowhere else.
Excessive fatigue.
Okay, what else?
Amenorrhea.
Oh, what is that? I never heard of that term.
Yeah,
Thank you, Lifeline. What else? What else? There's more. What else? There's one more.
fetal movement.
Notice those are signs and symptoms, except for the vomiting. That what? The person tells you. Can you see fetal movement? No. Can you assess the amenorrhea?
No.
The person tells you that. Can you see breast enlargement? Well, technically, you know. I mean, not if you don't. Huh? Thank you very much. Okay, tenderness. Tenderness, because they'll be like, well, how you know? How well do you know this? Okay, anyway. Tenderness. Can you assess it? Can you observe it? No. Okay. What is Dr. Semi stressing about? That she's making a big point that she can't move to the next concept.
Presumptive signs are subjective.
Think.
I got a staple. Oh wait,
No, figure. I can't afford staples. I ain't make money like that yet. You see? What does that mean? Presumptive signs are majority subjective signs. You notice that?
Yes.
Boom. Because the fetal, and notice what it says, fetal movement quickening. This is, and I also want you to make sure you pay attention to the timing in which she would experience the fetal movement around 18, beginning around 18 weeks. That's when she will see, and it's, let me take my time with this one because I have some questions. If you don't read that question carefully, I have to give you the look. It is normal. You see, when is the first trimester? How long? 13 weeks. And how soon can this individual start feeling fetal movement? If the client, by the second trimester. If the client is 14 weeks, does not feel any movement, are we calling a rapid response or code blue? Doctor, mayday? No! Okay. What am I trying to tell you? Pay attention to the time. Yes? You're stretching or you asking me something?
Is that 17 weeks?
It says 18. Somewhere else say 17?
18 to 20? That's what I read on those.
Where?
No, that was the other chapter that we read. That was there.
Oh, I'm glad you said that. Because it does change a little.
Okay.
So, 17 weeks in your book. Did I warn y'all guys about the changes? Okay. I forgot if I told the other group that. Okay. Group, if y'all hear it, 17 weeks, okay? But the soonest is 17 weeks. In other words, if it's 13 weeks and the mom is concerned or the pregnant woman is concerned that there's no fetal movement, what are we doing?
Nothing.
You never said you do nothing.
Not that.
Educate the patient. Yes, you never ever choose an assessment unless you're looking for the wrong answer. On the US of NCLEX, nurses never do nothing. Did that make sense? We always doing something. Either you continue to monitor or you just educate. We cool? Because there will be an option that says do nothing. And if somebody so much as to choose that answer to do nothing, I'm giving you the look. Okay?
Yeah, Daryl.
Are we cool? You see, I took my time on presumptive. So presumptive is mainly subjective data. And we move on over to probable signs of pregnancy. Daryl, what are the probable signs of pregnancy? See, she's telling you what the answer is that.
Teamwork.
Teamwork makes the dream work, right, Mark?
Braxton Hicks contractions,
Uh-huh.
positive pregnancy test for 4 to 12 weeks, hyperpigmentation of the skin, increased abdominal girth from uterine enlargement, and ballotment.
Big words.
Yeah, 16 to 28 weeks. Goodell sign 5 weeks. Chadwick sign 6 to 8 weeks. Heger signs about 16 weeks, and probable fetal outline.
So, what type of data do we mainly see here? It's a little bit, yes, objective sign. You see you see a mix of both. Okay, you see both objective and subjective, because the Braxton Hicks, can you observe Braxton Hicks? No. Okay, can you observe the ballotment?
I don't even know what that is.
I don't know. Oh, I don't know what it is either. Oh, okay, fine. I'll give you It's gonna be on your test, though. It's gonna be on your test. It's just 2 for 1. What is ballotment? Yes, Natasha.
It says allotment, the examiner pushes against the patient's cervix during a pelvic examination and feels a rebound from the floating fetus.
Natasha, please. Read for me one more time.
Says,
And explain it in Natasha's term.
oh, okay.
Oh, yeah. Hurry up.
It says that, I'll read it one more time. The examiner pushes against the patient's cervix during a pelvic exam and feels rebound from the floating fetus. So from my understanding, the patient goes for a prenatal visit, and does the doctor does a pelvic examination, and then they can feel the actual fetus when they feeling on the cervix.
Subjective or objective? Objective.
Objective.
Okay, you see that?
I have a question about the Braxton Hicks though.
Mm-hmm.
Would that, you know how like they set up the patient to the monitors when they're having contraction? Would that show up on
On the monitor?
as a contraction?
Okay, let's read. What is Braxton Hicks? What's Braxton Hicks? I don't know what it is. I ain't never heard of it in my life.
They're false contractions.
Okay, you can look.
It's in the book.
False labor.
What did Braxton Hicks say it again?
In layman terms, false labor.
False labor. Okay, so can you elaborate a little more?
So there's sporadic practice contractions that help prepare the uterus for childbirth.
Now, can we see it or not on an actual fetal monitor, the Braxton Hicks?
I want to say yes because it happened to me, but if you want what the internet says, stand by.
Lord, okay, please, Lord, make her use reputable resources. Dr. Google, please. Are we able to see Braxton Hicks on a fetal heart monitor? Yes or no? I don't know.
Braxton Hicks contractions on an external fetal monitor show up as low, irregular, and sporadic hills or waves on the contraction tracing. So yes. they
Yes,
do
you
show up.
can. It's just not going to show as a true contraction when they read it. Okay, look at that. Okay. Boom. So you have, now, if I was to ask you in layman terms, what is probable signs and symptoms? What is that? How would you define that in simple layman terms?
Things that
More than likely.
Okay, Natasha first.
probable signs would be something that we can observe from the patient, I guess.
Yeah, but probable signs. I just want a vague, a brief definition. Probable signs. What is that? How would you explain that? Don't talk about signs and symptoms, what's included in, but I want you to just tell me what in the world does probable signs mean? There's a reason why I'm going here. Okay, no, I know. What does probable sign? The term probable. What does it mean?
It's more than likely.
The possibility.
The possibility.
Yeah.
There's a reason.
I heard you, Mama.
There's a reason why I'm stressing this. So y'all don't go act to the fool on my test. Okay? Oh gosh. All right. Presumptive means what in lay terms?
Possibility. No.
Assumption.
Say it again.
Assuming.
Yes. You just got because you have lay vague symptoms, ain't nothing for sure. Yeah, you ain't got your period, you probably exercise too much, or you have other indicators that show why there's a possibility why you don't have your period. That doesn't, so we're just assuming you just missed one cycle or something like that. Yeah, you got nausea and vomiting. You probably ate something you shouldn't have eaten, okay? Or consumed something, or you just around someplace, some smell or something like that. Yeah, you're excessively fatigued. You're probably in nursing school. I don't know. You understand what I'm saying? So that's why you have excessive fatigue. Does that make sense? So these are presumptive. You have the vague signs and symptoms. Fellas, this doesn't count you, okay, of course. All right? But you have the vague signs. That's why we can presume or assume that, okay, or any Caribbean in the house, okay, y'all know how the Caribbean say, you sleeping a lot lately. Let me see your neck. Why you eating so much all of a sudden? Nauseous? I had a dream. I saw some fishes. I don't know. Okay, let me stop. All right. Okay, that's presumptive. I want you to understand the terms associated, like with presumptive. What does presumptive mean? What does probable? And definitely, what does positive mean? What? Juan Carlos, you see I didn't call you all night.
Yeah.
Positive sign means what?
Well, do you want me to say what's on?
No. I want you to tell me what positive means. You see, I just told you rule number something.
Absolute.
Only answer what is being asked of you. Positive sign. What does that mean? Positive signs of pregnancy. Hurry up before they steal your shine.
Something that you can see that you're pregnant.
Say it louder.
Signs that you can see that you're pregnant.
You on the roof, but I want a more
Factual. No.
It's not that you're wrong. I just want something more,
More savory.
more savory. Yeah,
You're leaving
That's how you got one, Carlos?
Yeah.
What?
Want to jump in?
Huh?
Absolute.
Ain't no doubt.
Ain't no
There's no doubt. You for sure pregnant.
It's the opposite of presumptive.
It's definitely.
Absolute.
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 Yeah, you got something baking in the oven. Okay, and it ain't roast. Okay, or chicken roast or whatever, how do you like to say it? Okay, you are definitely pregnant. Now, let me ask you, Gina, you notice positive pregnancy test is under where?
HCG.
Okay, well, that's not what I didn't ask what it has in it, but I asked you, hold on. Where it's listed under what, in other words? Probable, presumptive, or
Positive, probably.
Be careful. You see, I'm only on the first page. We for people. Listen, positive test, pregnancy test is under what? Probable. It's very important you note this.
Just because it's got 2 lines doesn't mean it's accurate.
Nadia,
Yes.
why would a positive pregnancy test be under probable and not positive when it says it's positive?
Because high elevated HCGs doesn't necessarily mean pregnancy, can also mean cancer.
Good job.
It's about that time.
I mean, drop the mic. I can say nothing more about that, okay? Moving on.
I'm not playing.
Okay. All right. So again, note the timing, give or take, that these signs and symptoms can appear. Please be mindful, yes, it does vary in the book throughout. Now, while it does vary in terms of the timing, for example, Braxton Hicks, it says you can see that as soon as 16 weeks. and I think somewhere else it says like 15 or 14, or even 13, something like that. My test questions is gonna be like very off. Like you should not be feeling Braxton Hicks by week 3 gestation, like bro. Unless you having like, I don't know, the eight octagon mom or something like that, I don't know. Okay, those kind of things. But again, just pay attention to the timing. Again, pay attention to the timing. Pay attention to the timing. Pay attention, what colors to what?
The timing.
Don't play with me. Okay, all right. So again, positive signs include ultrasound verification. So now you see ultrasound verification, fetal movement felt by whom? By the clinician, around 20 weeks. Again, just bear in mind that timing could vary, give or take, just by a couple of weeks. Auscultating the fetal heart tones and fetal heart rate is seen on the ultrasound. Those are all what type of data?
Objective.
I'm gonna let that slide. Objective data. Now you see why I'm stressing fundamentals?
Yeah.
You see why I don't want you to study and dump? Because the same thing gonna happen again next semester. What you learn, well, I ain't gonna lie, OB is kind of by itself, okay? But you're just gonna need it for, fourth semester when you revisit it again. So make sure, again, you pay attention to those signs and symptoms. Make sure you know what the different signs are. Ballotment, Goodell sign, Chadwick's. You must know this up until you take and pass NCLEX on your very first attempt. Don't play with me. Okay? Huh?
I said 85 questions.
Yeah. 85 questions don't mean you pass, bro. Huh? 85 questions do not mean that you pass. It's just the decision was made at 85 questions. You just hoping the decision is in your favor. I'll come back to that another time. Okay? Moving forward. Okay, boom. Now on page 303, you see I told you that little yellow box. Take note, don't play with me. The elevation of HCG corresponds to the morning sickness period about 6 to 12 weeks during early pregnancy. In other words, around that time period, you can see that there's an elevated amount of HCG hormones floating around. That's basically what that is saying, okay? Now, like Nelly was saying, an elevated amount of HCG could indicate tumor, but it could also, if there's nothing wrong with the client, it could also mean other things such as multiple gestation, maybe because the mom was taking certain medications, that's why the HCG levels were altered as well, okay? So that's that. Okay, moving forward. I'm too excited now, y'all got me. All right. On page 302, again, that's basically what I was talking about, the positive versus probable signs. That's what I was talking about, spending all this time talking about. Moving forward, the maternal adaptation during pregnancy, now on page 304. Judith, calm down. You need to know the different changes that happens physiologically. In other words, what is happening to the body as there's another growing body within this major body or the bigger body. In other words, the pregnant woman. Okay? So what I want you to know real quick, because we're almost out of time. The uterus, in regards to the uterus, it does increase in size and slightly in number. It will stretch and get larger as the baby grows. Duh, it should. There's a reason why I'm stressing that, okay? Now also, and I'll get to that point in a little bit, uterine contractility is enhanced as well, and you'll notice as the uterus is expanding and growing that this is when you have the Braxton Hicks, okay, which is like the false contractions or play contractions, like some of the people like to call it, begins during the first trimester. Braxton Hicks typically begins or is felt usually on the first trimester. And these contractions can continue throughout the entire pregnancy, okay? Becoming especially noticeable during the last month, okay? And I'll discuss more about that in the next slide. That's the uterus. Then you have the cervix, which again, you have the softening, which is the Godel sign, and you have the Chadwick sign, where it's the more bluish in colors. I promise y'all, unless y'all gonna be L&D nurses or OB nurses, like you like to say, this is the only time you're gonna need to know it up until you pass NCLEX. After that, the other thing that I need you to note with regards to the cervix, it becomes or makes a more mucus-forming, thick mucus plug. That thick mucus plug right there is what seals the cervix, protecting the fetus or the growing baby from infection. Okay, it's around 304 in my book. Okay, somewhere in the middle. Okay, I'm sorry, 305. We're talking about cervix. Okay, so I'm concerned about the mucus plug and the purpose of the mucus plugs. Okay, and you have about 4 weeks prior to birth. That's when the cervix begins to soften. It begins to be, it gets thinner, and it also starts to stretch. It does all of these physiologic changes, all for the preparation of birth. Okay, and that's all because the reason that they're even able, this change is even able to be done is because of the different hormones that play a role, all right? Because, you know, making it very flexible for delivery. The vagina, with the vagina, you need to know this as well. In pregnancy, you have an elevated amount of estrogen that raises the blood flow to the vagina, right? Causing it to be thickened, it stretches, and all of that, again, is for the preparation of birth. Many people will notice a more whitish or yellowish discharge called leukorrhea. It is normal. You have to educate the client and let them know this is practically normal. Now, when does it become a concern is when it's starting to stink. Okay, it should not be odorous or mild odorous, in other words. Okay, but if it's just that whitish, yellowish discharge named leukorrhea, make sure you know the medical term. Okay, and usually they see this around the second trimester. It is perfectly fine.
Unless it stinks.
Unless it stinks. Okay, unless you see it changes also in the characteristic of that discharge, right? Like instead of it staying whitish, yellowish, it's starting to get a little green, you know, more thick. Yeah, no. Okay, but it is fine. All right, that's the main thing I want you to know. Now, if you notice on page 305, under vagina, vaginal pH increases, leading to an increased risk for what?
Infection.
Which infection? Candidiasis. Don't play with me. Now, it is a benign fungal condition, which is definitely uncomfortable, but it can be transmitted from an infected person to the newborn baby. So that's why you want to make sure you take care of it before baby, you know, gets exposed to it, all right? Because notice what happens. This is also very important. Neonates can develop an oral infection known as a thrush, which presents as a white patch on the mucous membrane of their mouth. It is self-limiting and is treated with local fungal. Do not play with me. Now, when I told you what was rule number 1 today before the test? Okay, yeah, okay. 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 Don't play with me. Rule number 1. Rule number 1A, I guess. What did I tell you to do?
Read the question.
Read how? Carefully. Candidiasis is a what? Fungus. A fungus. Can we treat a fungus with amoxicillin? No. Can we treat it with Tamiflu? No. Don't play with me. Y'all took pharmacology. I heard y'all were good legal drug dealers, so don't play with me. Okay? I made it this one. Don't play with me, okay? So read carefully. I told y'all, I love drama in my scenarios. Okay? You're gonna have cases that you're gonna look at. Okay. Bam, that's what we're looking at. That's the vagina, and then the ovaries. The main thing about the ovaries is notice that it says the ovaries does enlarge again because of increased blood flow, but cannot be felt until after about 12 to 14 weeks, give or take. I think that information remains constant, but it's around 12 weeks that you will start to know that it's growing. Okay, that's when you can start feeling the ovaries. Ovulation should stop, okay, during pregnancy. And why I say should stop, because you'll see some people still have a menstrual cycle. They ain't know until they're ready to deliver that. Yeah.
And I got that.
I was like, oh, okay. I hear many stories, so it's like that. So anyway, ovulation should stop during pregnancy because pregnancy should prevent the release of hormones. That should happen. Hormones early in pregnancy, but by about 6 to 7 weeks, the body takes over the progesterone production. Then you have the breast. With regards to the breast, again, of course, you will notice that it becomes larger and fuller, and like we said earlier, it will become tender. They may also notice stretch marks that may appear as pink or purple lines, and later fade into silver, but do not fully disappear. Just note that with regards to the breast, this is what I want to make sure you also pay attention to, so Daryl don't give me problem. By the 3rd trimester, you got this thick, liquidy thing coming out of the breast. Are we concerned?
No.
Are we gonna say go get an operation?
No.
Why?
Because it's it starts with a C.
Colostrum, which basically means what?
Baby's milk.
Yes, and it's normal for it to leak, okay? We're not gonna have a heart attack or call a rapid or, anything like that. That's the baby's first food, okay? That's coming out, and boom. That's what I need you to know with regards to that. Now, you see the uterus, this is right here. Real quick. I want you to know, on page 305, the weight of the uterus, normal. Because I'm going to ask some questions, and you got to pay attention to what's normal and what's abnormal and how to intervene appropriately. The uterus should weigh about 1,100 grams, between 70 to 1,100 grams, with a capacity to hold up to 5,000 milliliters of fluid, okay? Now, on 305. On 304. This is on 305?
No, that was 304.
Oh, sorry. Okay, you're back. Oh, because I'm not, okay. I took this from the book, ebook. Now, this is what I want you to pay attention to. In late pregnancy, lying flat on the back can cause the heavy uterus to press on a major blood vessel. If it presses on that major blood vessel, what can potentially happen to this client? Okay, before that, what can happen? Why syncope? Do you know why?
Is it the vagus nerve or is it from the blood?
It's from the blood, sort of. So what? Because it's lowering blood flow to the heart. Okay, that's the main reason. So when there's decreased blood flow going to the heart, what do you expect the heart rate to be? High or low?
High.
No, it drops the blood pressure.
Oh, I thought no, the heart rate.
Oh, did I say heart rate?
Yes.
I'm so sorry. Elevated blood pressure. Okay, I'm glad. That means y'all paid attention. Just making sure. My bad. But the blood pressure decreases. Yes, you are absolutely correct. Heart rate elevates. Okay. When the person sits or stands, this can cause dizziness, like you guys mentioned. It can also cause nausea, weakness, or even fainting. So, what can I do for that? Jared, I ain't hear from you all night. Okay, what we do? Jared, I did all that entertainment for you. For you.
Yeah.
What did I say?
Yeah.
Oh my God.
Yeah.
I'm sorry.
Not flip them over. YouTube, help me out. Jared, I don't know. What's going on? Listen, Jared. So listen, when the person sits or stands, it causes nausea, dizziness, weakness. So what can you do to help with this?
Put the patient on the side.
Thank you. Thank you. Turn them onto their side, preferably. Yes, to relieve that pressure. I'm glad you said that, but most questions they'll say put them onto the side, but if you have to choose between right or left, if that question want to be nitpicking,
Left.
thank you, okay, to help improve the blood flow. That's, Jared, don't play with me.
Okay.
Now I'll make sure I create that question just for you.
Okay, do that.
Oh Lord, I'm in trouble.
Dr. Jared.
Oh gosh, now listen. 305 in the actual book. That take note right there. Don't play with me. Jennifer, talk to me about the fundal height. Hurry up.
About what?
The fundal height.
The fundal height?
The fundal height.
Isn't that supposed to be like oh, here it is. It says here actually between, I thought it was 1 and 2 inches. No? I don't have a glove.
Is it like 1 or 2?
What you talking about? Help her out, Mariah.
Somebody, yes, please.
The fundal height. What can you tell me about the fundal height?
I'm not too confident in that I know the date and the time, but I believe it starts at the umbilicus and then it goes down like 1 below, 2 below, and then goes back up, 1 above.
You don't have the book?
Yeah, not with me.
But you have the ebook.
Yes, on here.
Okay, YouTube, I'm gonna talk to you for a little bit. Can you explain to me why students don't want to open their book
I'm
during
allergic to it.
class? You allergic to the book?
Any student with the book.
You
And I have a book answer.
don't have the ebook?
Oh, I have it on here.
Yeah, get your ebook. It's same information.
I'm not logged into that.
Oh Lord, Amanda. Okay,
Anyone with the books.
Jessica.
Fundal height usually be correlated with gestational weeks, most accurately between 18 and 32 weeks. Obesity, hydramnios, and uterine fibroids interfere with the accuracy of this correlation.
Okay. Plain English.
It's gonna move.
Where? How? Well, not where, but how?
It's gonna move down?
Up. It goes up.
Up.
And then at 36 weeks it stops, and then it starts to go back down.
Thank you. If you go back to page 304, that very last paragraph on the right-hand side, y'all better fall in love with that little piece of information. Yes, that will come up multiple times throughout the semester. Okay? Multiple times. What happens? The uterus becomes ovoid and increases in width, not decrease, at least not yet. By 20 weeks gestation, what? When 20 weeks mark, what does that mean, 20 weeks gestation?
That's what, second trimester?
Okay, yeah. Yeah, second trimester. So okay, but 20 weeks gestation basically means
Halfway.
What, 2 weeks? I mean,
you're 20 weeks pregnant. That's
Right.
all it means.
Oh, okay.
You're halfway there.
I know.
Yes, okay? Now look, guys, don't play with me on this. By 20 weeks gestation, what happens, Jessica?
Which one?
By 20 weeks gestation, what happens to the fundus?
The level of the umbilicus measures 20 centimeters.
Oh.
So the level.
And continue on.
A monthly measurement of the height of the top of the uterus and corresponds to the number of gestational weeks is commonly used. So the fundus will reach its highest level at the xiphoid process.
Before we go there,
Yes, ma'am.
what did you just read in plain English?
It moves per week. It goes up by an inch.
So if the client is 24 weeks gestation, Gina, and you go measure the fundal height, where do you expect it to be in terms of measurements if they are 24 weeks gestation?
6 inches?
24 what? Centimeters. Guys, don't play with me. You see I'm taking my time with this one.
But 24 centimeters from the umbilicus?
From the top of the uterus. Yes. So it's hold on. At 20 weeks gestation, it should be at the umbilicus. When you measure that fundus, it should be right there by the belly button. Okay? And then it is going to continue to grow. But by the time you get to 24 weeks gestation, you should be measuring it, and it's going to be 24 centimeters. Make sure you pay attention to the units, because yes, I love to do that, just to make sure you're reading carefully. You know what I'm saying? Because I could say 20 yards. Good. Or 20 inches, and you need to look at me like, okay, what vodka was she on tonight? You know what I'm saying? I don't drink, okay? You had your hand raised in the back.
But you start from like the census pubis, right? Like you start.
Whoa. I don't know. I don't know. Hook me up. I don't know where to measure. Huh? What's right here? Because right here for you is not, it may be right here for me.
Right on top of the, like where, like your vagina, like the top of the, not the vagina. The mons pubis.
The mons pubis, yes. Okay. So where do we start measuring? That's a very good question. Okay. I'm almost tempted to ask if you have access to my exam, but anyway, I'm not going to. Okay? But yes, where do we measure from?
Top of the bone, the symphysis.
The symphysis pubis. Make sure y'all know your A and P. You have a question, Angel? Oh, no? Okay. All right. Make sure you know your anatomy. Jared, don't play with me. Jared, where do we start measuring from to get to measure the fundus, the fundal height? Where do you start? Oh my God.
The pubis, right?
The simple pubis? Okay, I'll take it, the simple pubis.
If it was on the test, I'd get it right.
Okay. You know, I should put that as an option. Symphysis pubis, simple pubis, pubis. I don't know. All right. So, again, now, Mark.
Ma'am.
Your client comes to you, right? They're on their last trimester, and they tell you that you find out they are 36 weeks pregnant, okay? 36 weeks gestation. As the great fantabulous nurse that you are, you go ahead and you measure the fundal height. Where would you expect now for the fundal height to be?
36 centimeters?
At 36 weeks.
36 centimeters?
Is he right or is he wrong?
He's right.
Okay.
All the way up here.
Gabriela! ¿Tú tienes? You speak Spanish, right? No? Oh, my bad. I was going to force some Spanish. Okay, so you were Juan Carlos. Okay. You have a client who is 40 weeks pregnant, 40 weeks gestation, and as the great fantabulous L&D nurse that you are, actually OB nurse that you are, you say, you know what? Let me go and measure this fundal height to make sure everything's all right. Ooh, okay, anyways, right? Okay, and then where would you expect for the fundal height to be now?
40 centimeters.
Is she accurate?
No.
Oh, you got some haters in the house. What? Why?
It starts to go back as the baby gets into position.
When does it start going down? The fundal height start going down?
38 to 40.
Yes. Okay. You expect the fundal height to decline or decrease starting at 38 weeks. It reaches the maximum point at the xiphoid process at 8 weeks, and then that's when it starts to go down. Okay? So, like it says, by between 38 to 40 weeks, fundal height drops as the fetus is doing what? Why would it go down?
Engaging in the pelvis.
Huh?
Engaging in the pelvis.
It began what?
Engaging in the pelvis.
What's engaging in the pelvis?
Getting ready to be born.
Oh, okay, the fetus. So in other words, the fetus is trying to exit.
Yeah, he's trying to.
Okay. He's being, what's the word when you kick somebody out their house?
Evicted.
Evicted. Okay? There's an eviction notice. So if at 40 weeks you notice that the fundal height is at 40 centimeters, what do we do?
You are going to be
We're gonna
induced.
induce that.
We're gonna get that baby out.
Okay, because what could that mean? What does it mean?
That's beyond cooking time.
Huh?
It's beyond cooking time.
It's beyond time. The baby's not moving. It should be descending. So if the baby's not going down like it's supposed to, because the baby's supposed to be ready to come out and be grown and act a fool. You know what I'm saying? Okay, maybe not act a fool. You understand? Just like when we 18, we want to leave the parents' house. The baby's supposed to want to. You know? We are. That's what's supposed to happen. If that's not happening, there's a problem. Okay, why isn't this baby descending? Is there too much amniotic fluid? Is there something blocking? Is the placenta in the way? What's going on? So now that warrants further investigation. You have to make sure the provider is aware, because that can become a medical emergency. Are we cool on that? This is why nursing process. It is very important for you to collect pertinent data. Are we cool? So you can plan and intervene appropriately. All right? All right. I done spent a lot of time on this. I don't even know what time it
Really
is.
quick, Professor?
Yes.
In regards to fundal measurement, you can refer to 345 bottom right for fundal height measurement.
345?
Yes, 345 to 346.
Oh, that's the next chapter. But okay. Okay.
Well, if you want to reference like
Oh, yes.
more in depth.
And that you definitely need to know. That was today's latest chapter. Okay. All right. Very good. Okay. Boom, 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 boom. Also, make sure you know when the fetus is going down, that is called lightning as well. Okay. That's just like how lightning strikes coming down. And what does the mom, as the fetus is coming down, what does the mom usually experience at that time?
Sharp pain.
Sharp shooting pain. What else? Huh?
Water breaking.
The water may break. What else? How about urinary frequency? You gotta go because it's pressing against my bladder. Okay, those kind of things. All right. Now, what's happening GI wise? I put it that is lovely. You
You
see?
ain't got no stomach no more. Square.
For real.
Can't breathe.
Anyway, let me keep it moving. This is what I want you to know. Okay, what happens GI wise? This is what I'm going to be testing you all on. GI tract is going to slow down for sure. Okay? They start feeling increased or elevated heartburn. You see, I was nice. I see how much I like y'all. You see, I put the medical term for you, because I might decide to be nitpicky, and put pyrosis. And Juan Carlos told me you only speak English, so you should not have a problem to know what the word pyrosis means. Juan Carlos, don't give me problems. You see? You've been warned, okay? So I put these are the stuff that I'm gonna test you on right here, all right? Heartburn or indigestional problems, also known as pyrosis, very common. What we gonna do for heartburn and for pyrosis? What can we do for that?
Give them milk.
Give them milk. Okay, before we give them medication, is there anything we could do?
Milk. Milk.
Milk. Okay. Anything else? Sit up. Don't go lying down right after you eat.
Don't eat acidic foods.
Huh?
Don't eat acidic foods.
Very good. Watch what you're eating, in other words. Okay.
Be happy, that's a telltale sign that your baby has a lot of hair. That's a joke.
Be
That's a
happy.
joke. I've heard that too before. Also, I know I didn't put it on. Yeah, it is here. You see, it is here. You see, I can't pronounce this word. But just because I can't pronounce it doesn't mean I'm not going to put it on the test if I don't feel like it.
you say it.
I don't know. Tyler something. Tyler systems, that, okay? Just make sure you know it. And it means what? Excessive what? Saliva. Now, in your book, in addition to Tylonism, there's another word for excessive saliva, also known as sialorrhea.
That's it to 2 ears.
Huh?
Yeah.
Say it again.
That's a lot of.
Let me tell you, it's serious. Okay? It be serious. Other GI issue that does take place: constipation, bloating, morning sickness, gallstones. They are at risk for gallstones, so make sure you know this. Pica. What is pica? Eating with non-food stuff. Dirt. Is ice considered?
Yes.
I asked you that last week?
No.
Oh, okay, just making sure. Yes.
Could you say the other
Indicative
word
anemia.
for excessive saliva, besides the one that's on the PowerPoint, you said another word.
Oh, sialorrhea. Yes. Okay, it's in the book as well. Okay.
People who are anemic want to eat hours all day long.
Yes. Now, just notice ice, because I know, I think it's in your book. I don't know if it's in this chapter or another chapter, but ice is considered a form of pica. It's when you like constantly wanting to eat like jugs and jugs of ice. That's not cool. And like it was mentioned, I don't know if it was you, Nelia, but it can lead to or cause anemia. Okay. All right, team. So that's the main thing with regards to GI. I put all this stuff right here. Etc. All of that, hemorrhoids, okay, from sitting constipation. So if you know that they're at risk for constipation, what are you telling them?
Drink water and move.
I like it. Get your butt up, okay? All right, the hemodynamic change. What's happening? Basically, we already talked about it a little bit. With regards to blood volume, it does increase, and because there's an increase or more than an increase or significant number of red blood cells, the blood can become very diluted, causing them to be to have physiologic anemia. All right. The heart rate can also change. It increases by about 10 to 30 beats per minute from their baseline. This is why it is very important for you to always collect baseline vital signs to compare and know any trends, okay? If it's going up, going down, because especially when it comes to the cardiac system, the blood pressure, we are closely monitoring this mom for issues such as, what's the issue with elevated blood pressure?
Preeclampsia.
It's not on me in this test yet, but yeah, it's coming. All right, blood pressure. I said we need to know. I already talked about what should be done. Blood components. Again, iron needs increases again because they can become anemic. So we want to make sure that they either are taking their supplements, they are eating, consuming foods that has a good source of iron, or iron-rich foods, but blood becomes more likely to clot. That's another main thing, okay? Increasing the risk of?
Blood clots. DVT.
All right. This is why you are closely monitoring your mom. All right? For swelling, especially if you see one leg bigger than the other. Emergency room. Okay, let's go. All right. So you want to note those different changes. All right. Boom. What else? Now you have. Oh, I changed this a little. Renal. Okay, on page 309. What's happening? Again, the urinary system, because of the physiologic changes that we just talked about, for example, that are taking place, now the kidneys and the urinary system is going to be working a lot harder. Blood flows to the kidney increases, allowing them to filter more waste. And now the kidneys, you will notice, you will notice, but if there's an exam done, or diagnostic exam done, the kidneys will start to enlarge as well. And that kidney enlargement that's what causes this client to urinary tract infections, okay? There's an increased risk for UTIs. What else? So again, lying on the side improves kidney flow because the kidney clears drugs faster. Some medications may need higher or more frequent doses during medications. Now, when it comes to giving medications to a pregnant woman, person, pregnant clients, okay? The provider will definitely weigh the risk versus the benefits, because again, just like we learned, it was with y'all we learned the teratogens, right? Some of these medications are teratogenic. However, the problem is if the mom has been on these medications for an extended period of time, like seizure medications, you can't just stop abruptly. It has to be tapered down, you know, those kind of things. So again, they have to weigh the benefits versus the risk, okay? What else? That's the main thing I need y'all to know with regards to that. Just note the timeline, what happens to the GFR, renal blood flow increases. Okay? Now, the structural realignment and what happens with the skin. So in other words, the main thing, in other words, with the musculoskeletal system, because the baby is growing bigger and bigger, the body has to support this growing fetus. Now the mom's body is going to be changing, right? To support this growing fetus. Weight gain and growing fetus shift from the body's center of gravity, changing the posture and the way the mom walks. How they gonna end up walking?
Their belly is
Like that. I was with these girls, with my two girls. Oh Lord, okay. So you're gonna be, and what really helps with causes that, not help, but what causes that is the hormone relaxant. You should know it just in case it comes up on the benchmark, but I personally don't remember if I put a test question on that. All right. So you do need to know that the joint changes peak by the third trimester. There is an increased discomfort with lower back pain. We did say that they're gonna have the waterly walk, back pain, hip pain, pelvic pain, leg cramps, foot pain. They're gonna have pain everywhere practically, even in the hands and wrists, okay? So that's the main thing you need to know with regards to the musculoskeletal, is the hormone relaxant causes the pelvic system to, the pelvic bone to relax, hence the waddling, all right? Skin, yes, there is changes to the skin on page 310. All right, it's talked about the main changes that you should not you should not forget, or that you definitely have to know. In other words, linea negra. You cannot go through nursing school not knowing this, okay? Because then they're gonna be like, what school did you go to? Okay? All right, what is linea negra?
That's the line of the belly.
Yes, okay. And it extends from the umbilicus all the way down to the pubic area. Everybody gonna get it. It's a nice little picture. It don't matter where you from. Like Jackson, it don't matter if you black or white. You gonna have it, okay? And some are more pigmented or darker than others, the linea negra, but practically everyone has the linea negra, okay? What else in terms of skin changes? They're gonna have you may see hyperpigmentation of the nipples, the areola, even in the genitals, sometimes in the face. When you note the hyperpigmentation in the face, there is a term for it that you should be familiar. It's called melasma. Make sure you know that. They call that the mask of pregnancy, okay? Yeah, melasma, melasma, is somewhere in your book, okay? So you should know that. And then also the stretch marks. Know the other name for stretch marks, which is striae. Good, because y'all said it better than I would have, all right? So again, know the medical terms, and it could appear practically in many places, the abdomen, the thighs, and other areas, etc., right? So the stretch marks, you can see it in many places. You're also going to know with regards to the vascular changes, the veins, okay? So there's going to be, some women are more at risk. Not every woman has it, but they have what's called varicose veins in the legs. Sometimes they call them spider veins as well. They could also have palmar erythema or pink palms, in other words. You can see, in other words, they're pink, their palms. Some of them are very, very dark pink, almost reddish. But it does, or should, fade over time. I still got mine, so. Yeah, all right? Now, with regards to the vascular changes, please don't play with me and make sure you pay attention to the tips, or in other words, the interventions that you can educate the client to do to help with those vascular changes. On page 311, the bullet points, elevating both legs when sitting down or lying down, avoiding prolonged standing or sitting, change position. If you were sitting for an hour, get up, like Jessica said, get your butt up. Okay, Jessica, right?
No, Samantha.
Samantha, my bad. I will get y'all names together by week 16, I promise, okay? Walking daily, go exercise, okay? Avoid tight clothing. This is not the time to be looking like Kim Kardashian, you know? We don't need no girdles at this point, all right? So avoid tight clothing and wear support hose if you do have existing varicose veins. All right, that's the main thing. And then of course the hair and nails, the growth slows down. Hair growth does slow down during pregnancy, but afterwards, but after birth, the hair loss may occur for about several months. You see, men? Y'all better appreciate us. Go bald for y'all, okay? Nails grow faster, but can become brittle and discolored and develop grooves, all right? But it should come back to normal. All right, that's the skin. What did I do with this? I'm trying to move faster.
Yeah, we're running out of time.
Oh, what time is it?
7:40.
Okay. I know what I'm gonna do real quick. What is this? The metabolic? Metabolic. Just know what happens metabolically, the insulin and the glucose, what happens to the insulin levels. This is the reason why they can develop or are more likely to be at risk for gestational diabetes, okay? The main thing I need to know is that just because you have gestational diabetes is not a life sentence. You may not, it may resolve postpartum. However, it does increase the risk of having diabetes if you don't take care of yourself, okay? And then you have the immune system. The main thing that I want you to know with regards to the immune system. Number one, what is the normal white count? Does anybody know?
5 to 10,000, 5,000.
5 to 10. Later on, we're gonna note what is normal. But for now, I want you to know that it is normal for the immune system to be acting up more, in other words, right? Because it's trying to protect the fetus and the mom. It's responding to the physiological changes, especially because of those hormonal changes that are taking place. So, in other words, the body does boost immunity, but reduces targeted immunity, helping the body to prevent rejecting the fetus. Hence, that's why the immune system is acting the way it does. What I am going to do, I am going to revise the PowerPoint, and I'm gonna tell you by YouTube. I can't post this. Okay? How do I stop this? Oh, X. Okay.